To wrap up the methods section of the course, I want to spend a little bit of time in this video talking about ethics. And there are a lot of ways you can go about talking about ethics in a research course, and indeed there are entire courses that are devoted to ethics. But any good science course is going to at least talk about it a bit. And these are some ideas that I want you to think about as we're going through the whole course and even other social science courses you take that have to do with human subjects. Because there were not always good safeguards about how researchers treated human beings. And no matter what sort of study you're doing, you need to think about the well-being of participants and any risks that you are exposing them to. So, you know, in the 18 and early 1900s, there wasn't a lot done about keeping people safe in studies, particularly in medical research or when people were imprisoned. So a lot of the changes that came about in the last century were because of a few things going on in the early and mid 1900s. Maybe first and foremost, the actions of Nazi doctors at concentration camps and other places around World War II in Germany and other parts of Europe ended up being exposed to the world and formalized in the Nuremberg Code in response to the Nuremberg trial. So the medical experiments that German doctors were carrying out without the consent of the people that were imprisoned, these were, of course, human rights abuses that required attention. But I think we might oftentimes minimize the fact that these things have happened more recently and closer to home for a lot of us. In the United States, I have examples here from the Tuskegee syphilis study and some more recent social science type studies. But I want to talk just a little bit about the Tuskegee syphilis study if you're not aware of what that is. In 1928 in Norway, there was a study about the effects of untreated syphilis on people. And this was met with some fanfare in the medical community because it was a retrospective study looking at how syphilis had progressed in people. And if syphilis is, the sexually transmitted infection, if it is left untreated, it can develop into neurosyphilis, dementia, brain damage, and ultimately death, along with lots of other complications. So this was an important study to understand what syphilis was, how it progressed, but there was no prospective study following people infected with syphilis to see how they fared. And some researchers at the CDC and Public Health Service in the United States took it upon themselves to do that prospective study, but the way that they went about it was harrowingly unethical. They recruited 600 impoverished sharecroppers in Alabama and associated themselves with Tuskegee. I can't remember if it's Tuskegee College or University there, but a historically black college to give them some credibility. And they recruited these poor sharecroppers and determined which ones of them had syphilis and which ones didn't. 399 of those 600 sharecroppers had syphilis, but colloquially there, people just referred to it as bad blood, which could have been a lot of different ailments, anemia, fatigue, syphilis, other things. And they weren't educated on what syphilis was necessarily, or able to recognize that that's what they had. But these public health workers knew that that's what it was, so that's why they studied it there. So they began observing how syphilis progressed in these people who were, getting supposedly some medical treatment but really they were just getting like samples taken, even spinal taps and things like that, having samples taken from them for cataloging in this big long study. This started in 1932. By the time World War II was breaking out, some of these people were drafted into the United States military. And they were given physicals, and there was some tension between different governmental organizations when the Public Health Service and CDC said, hey, you can't tell those guys that they have syphilis. We need them to be unaware so we can see how it progresses. So they were knowingly and intentionally keeping treatment from these people and only allowing them to have treatment that was poisonous in some ways, like arsenic or bismuth, elements that are toxic were used to treat this. So they're obviously doing this very purposefully. Now, by 1947, penicillin was a very easy and widely used treatment for syphilis. It cures it. But even after that was discovered and used very widely in other populations around the world, the participants in this study were not given penicillin. They were not told that it treats syphilis. They still didn't know they even had it necessarily. And you might be alarmed by thinking that no one thought this study or the design or its implications were a problem, and people did. There were people that wrote to the people carrying out the study saying it was unethical, but for the most part, their letters were just filed away without any response, or they were minimized in some way. And this study went on until 1972, when one whistleblower wrote to the Washington Star, and the story was later picked up by the New York Times to shed light on all this when the study was finally called off. So this was just about 40 years that these 399 men were just left with an untreated disease to see how it went, just so we could learn about it. So by the end of that, only 74 or 78 of them were alive. 28 of them had died from syphilis, 100 more from complications of syphilis, and perhaps even worse in some ways, 40 of them had given syphilis to their wives or partners, and 19 of them had had children born with congenital syphilis because they did not know that they were infected. So the human toll to this is enormous, and the way that it undermined trust in public health, not just in the Black community, but in many other communities and in general, is it's hard to even quantify it, right? So at least this, in many ways, led to some of the reforms in the 70s about how we treat human subjects. In 1974, Congress commissioned or created a commission to study human subjects' rights, and eventually, with a lot of these other things I'm bringing up, this led to the creation of the Belmont Report, which is something you might cover in more detail in a research methods class, that says participants have the right to beneficence, to be treated well, have the right to have their personhood respected, so they can decide, what types of things they're willing to consent to, and that there's justice or equity between different participant groups, and there are not discriminatory actions going on. So this all, eventually there were settlements, civil settlements that were not very large. And it wasn't even until the 90s that the United States actually apologized for this happening. So very too little, too late in many ways. So I know that's a lot of detail, but I just like to emphasize how easy it might be for people that think that they're doing something that's useful, like studying this disease, to be able to see how it progresses and how we might be able to learn more about it, might disregard the well-being of others in the name of what they're studying. Similarly, we'll talk when we get to social psychology quite a bit about something called Stanley Milgram's obedience study, which kind of abused people psychologically. And we won't talk about this, and it's very much discredited. Philip Zimbardo's Stanford prison study, where people were basically locked in a basement on Stanford's campus, and other participants were encouraged to abuse them as guards in a fake prison, basically. So all these things kind of together led to a big reform in how we treat people in human subjects research. So nowadays, every university has that gets any sort of federal funds, including many private universities like Hamline, they all have institutional review boards, which are people from inside and outside of the university from different areas, different disciplines, that review every study that has anything to do with human participants. Oh, and I do have the Belmont report on here that came out of this. That these ideas I already mentioned of having an eye towards welfare, distributing burdens and benefits equally, and giving people the right to make their own decisions. So these are all very good moves that have been made, in the last 40 or 50 years to give people more agency and respect and equity as they're being involved in studies. I do like, though, to point out that there are important ways to maximize the likelihood that we're doing this. One of the things that you must do to make sure this is happening is give participants informed consent when they are being involved in a study. Tell them as much as you can about it beforehand so they can determine whether it's appropriate and they feel safe being involved in it. And you must debrief participants to tell them after a study everything that you did, why you did it, and if you deceive them in any way, be able to tell them, hey, you can take your data away from me, and we want you to feel good about how this went. So this all involves very careful consideration of every benefit the participants are getting and any potential risks you might be exposing them to. You want to minimize the likelihood that you're going to use any kind of deception too. But sometimes, especially when you're studying people's beliefs or attitudes or expectations, it's kind of unavoidable to deceive people. You might invent some kind of situation that they're not really going to be in, right? So that is inherently unethical, that you're going to mislead someone. But is that a risk that is outweighed by the benefits of that study? Something for each researcher with the help of an institutional review board to determine. And we'll talk about some studies later in the semester that do involve some deception like that were handled some well and some poorly. One other thing I would mention is that these types of things I'm talking about, they only apply really to universities, unfortunately. One example of a study that was carried out recently outside of a university context is something that happened at Facebook in January 2012. So Facebook obviously has the data from billions of people, and in the United States in 2012, they took the news feeds of almost 700,000 people and randomly assigned some people to have more positive or more negative posts from friends in their feeds. And they wanted to see, does seeing positive or negative content lead to more positivity or negativity from those users? And they did find that there was a small effect that if you saw more positive stuff from your friends and family, you posted more positive things. The same for negative things. If you saw more negative content, then you posted more negative content. And the way that companies like Facebook get around this is that they say that the terms of service that you agree to when you start using Facebook is basically a catch-all informed consent, right? That you're saying that they can do essentially whatever they want to you within their product because you've said, I'm going to use it and it's yours. You can do whatever you want. But it's extraordinarily vague. It doesn't really count to be informed consent in the way that we might think about it in a scientific setting. And it's just unfortunate that the way human subjects' rights are set out, they don't really apply to the corporate world or the private sector in a way. So are these studies really unethical? I mean, we might think about those principles of ethical research I mentioned. Is beneficence a problem? I mean, did it really harm anyone? Well, probably not really. It's relatively small. Was there some injustice? No. I mean, the benefits and burdens were probably not unequal in any way, but it certainly shows a disregard of respect for persons, right? The people are not really being informed. You might have been a participant in that study. I might have been. I don't know and will never know because Facebook doesn't have to tell anyone anything about what they're doing. And this is the same for other companies, right? That like Google, Amazon, Facebook, Microsoft, all these companies have an enormous amount of data that they kind of disingenuously call behavioral surplus to imply that it's useless or valueless when it actually is their entire business model, that they use to predict behavior and manipulate in one way or another. And they're outside of these bounds of ethical research, even though they are doing human subjects research constantly. Anytime you log in to any of these social media sites or anytime you use Google or Amazon, you are more likely than not being entered into a study all those times. It's called A/B design studies, where they're just tweaking something like the colors in the Google logo, or how the buttons look, or how things are arranged. They're constantly doing this, and a lot of times it's useful product design type things, but other times it might be things that are not useful, like showing somebody who is an addict an alcohol ad, or showing someone who's a gambling addict something about a gambling website or a phone game app that has them spend money that they don't have, or something like that. And those are just the first examples, but obviously these companies are not respecting people's rights to make their decisions, and it is very difficult to put limits on how they're doing this, in the same way that we have in university types of human subjects research that take federal funds. So um, whenever I talk about this ethical stuff, I like to point out that this goes beyond just the things we talk about in class. It goes into your everyday lives, and there are ways that it, maybe can or should be limited, that are useful to be aware of. All right.